Hi, my name is Dr. Trevor Turner. I am the Atlanta Society of Physician Entrepreneurs chapter president. Thank you so much for joining us today for this fantastic talk that is coming from Dr. Dirk Schroeder, who is the CEO of Updraft Health Advisors, as well as the professor of entrepreneurship for global health at Emory University. Today, Dr. Schroeder is going to share a little bit of his story about founding Ola Doctor Incorporated and the pivots along the way from going from a Spanish language digital health company that ultimately got acquired by a large public health insurance company. And we'll also kind of talk about some of the key strategies and relationships along the way that brought him to that point, as well as other key relationships and strategies that entrepreneurs throughout the health innovation ecosystem have faced when trying to get their best idea out to a fantastic product that solves problems and creates value for society at large. So without further ado, I'd like to thank Dr. Schroeder so much for joining us today to present his journey and present stories of other successful entrepreneurs within the health innovation space. And using this platform, we do have the ability to take questions throughout. Dr. Schroeder won't be monitoring it, but I'll have the opportunity to do that. So in the pane on the right of your screen, if you care to chat or ask questions, go ahead and type them into the screen, and I'll be happy to relay them to Dr. Schroeder at appropriate intervals, and we'll have time for brief Q&A at the end. Thanks so much for joining us.
Thank you, Trevor. Thanks, everyone. Good afternoon. So as Trevor said, I'm Dirk Schroeder. I am happy to be here with you this afternoon. And for the next 30 minutes or so, I'd like to take you through the journey that I took as an accidental entrepreneur, and I'll talk about that, as well as some insights I've gained in working on a book on the topic of getting past the pilot. So let me go ahead and jump in. I'm going to fly through a number of slides, but I am very committed to making sure we've got time for questions at the end, and we'll have a good discussion about this very important topic at a very challenging time, and I'll talk a little bit about that as well. So first of all, let me start by saying, you may have heard that entrepreneurs are born and not made. Well, I'm here, I think maybe good news, to let you know that this is fake news. In fact, I'm an accidental entrepreneur myself. When I was young, you read about these people these entrepreneurs, you probably heard stories, they're selling shoelaces out of their kindergarten lunchbox and that kind of thing. I actually had no interest in business, had no knowledge of business, and I think the only thing I sold my entire life before I co-founded Ola Doctor were 6 tomatoes from my mother's garden, 5 one that I sold to a neighbor, and 5 that I sold to my mother. So I'm an entrepreneur that learned on the ground. Prior to starting Ola Doctor, I was sort of cruising along happily in academia as a professor of global health at Emory. I'm in Atlanta. I read soon after I founded the company that college professor is one of the most secure jobs in the country. Being a healthcare entrepreneur obviously is not one of the most secure. I got tenure in September or in August of 1999 on a Monday. And I know it was a Monday because on that Friday, I was at a cocktail party with Roberto Estrada. We were chit-chatting. He had just sold his company. He said, "Hey, what do you think about this internet thing? Is it a fad? Is it going to be around for a while?" And for those of you too young to know, this is the time when the internet there was an actual paper book guide to the internet called the Rough Guide. So this was way back in the day, and I'm sharing some of this early history because there's some analogies here, I think, with what we're going through today. So I gave up tenure, co-founded the company in Roberto's basement. And our goal was to be essentially like WebMD in Spanish. We wanted to set out to create the largest Spanish language healthcare website in Latin America. And we were really focused on Latin America rather than the US at the time. Because I came from public health, I actually made sure that we had a social mission, which is by doing this, we hope to address health disparities and advance health information and access to Latinos. The name of the company at the time was Dr. Tango, which sort of stuck around. Then we changed the name halfway through to Hola Doctor. So the outline of my talk today, I'm going to just take about 6 or 7 more minutes to tell you about my pilot journey, how we did what we did right, what we did wrong, which was plenty. I'm also going to share some insights that I've gained through interviewing about 110 senior healthcare executives worldwide, exactly on this topic of getting past the pilot. And then I want to end, because we can't ignore it, with some thoughts on doing all of this within the context of the pandemic. So let me start a little bit talking about my journey. And somebody's typing, so I don't know if somebody needs to be on mute. So just to let you know, so we started the company. Like many of you who've started companies, this is an exciting time. This was 1999, so we partied like it was 1999. Kept an eye on things, added staff, added resources. But just like now, in April 2000, in this case, the first dot-com bubble burst. So we were faced after 6 months with making some really hard decisions. We had a few resources in the bank, but we did, again, like many of you and many entrepreneurs today, have to make some difficult decisions. This is the number of employees we had on a Friday. We met on, as usual, on Sunday, and this is the number of employees we had on that next Monday, including the fact that I needed to fire my niece who had just flown from Spain. So this was painful, but we did get through it. So one of our first rookie mistakes, and I'm going to share some sort of mistakes and insights on building Hola Doctor and beyond. You know, one of our first rookie mistakes it was that we built a company around an idea, a technology that we thought was cool rather than a problem. And you'll hear me over the next 30 minutes talk a lot about the importance of identifying the problem that you're focused on. And this really came from those interviews that I'll talk about. We're also way too early to the market. So we realized later that in 1999, there was only a few million Spanish speakers online. We hadn't done our market research. Now, of course, there's 500 million. So we were just about 10 years too early to the market. So we, again, like smart entrepreneurs, pivoted, and by luck, the U.S. Census came out at the time. So I'm always telling my students, make sure you're reading, make sure you're staying on top of the news and the trends and demographics. Hispanics were the big news. And we said, well, what about, forget Latin America for now, let's look at the US and see if there are hospitals and healthcare systems here that have a problem with marketing to this population, compliance, regulations, and quality scores. So that's what we did. We refocused the company and started building culturally relevant, digitally based, culturally optimized healthy programs, diabetes programs, that kind of thing. So then we got to a point where we said, well, we want to get these out there, but we don't want to spend millions of dollars. We didn't have millions of dollars. So I think one of the other sort of key tips here is we partnered. We said, okay, where are the people already? Rather than spending $5 million trying to market to these folks, why don't we just channel through Univision, which already has them? So we exchanged our content for promotion, and we had about 1 million Hispanics accessing Medieta within about a year. So that was great. We thought, okay, we got this. Let's now go start talking to health plans. They're going to love it. So we started talking to health plans about Medieta. We thought, you got lots of Hispanic members. Of course you'll want it. Well, wrong again. Another couple of rookie mistakes. Even though we had 1 million consumers using the program, we didn't understand how health plans bought. We couldn't clearly demonstrate how the problem that we were proposing to solve would impact the health plan's bottom line, and other sort of rookie mistakes we made walking into these C-suite meetings without being well prepared. And again, I'll come back to that. So we said, okay, we need to go get scientific data. I wrote a grant to the Robert Wood Johnson Foundation. We got about $400,000. And this was key. we went back to the plans and we said, hey, we've got this foundational grant from the Robert Wood Johnson. How about if you each chip in $75,000 of additional resources, and we will do this great randomized trial of Medienta compared to non-culturally appropriate programs. We'll look at online and offline, see if it works. They loved it. We did the trial, 1,000 Hispanic health plan members, and it worked, fortunately for us. So the statistically significant impact of better engagement, better weight loss. We also did a lot of data collection. So one of the things that really comes out over and over is collect all the data you can. We collected both quantitative and qualitative data, including
Dr. Schroeder?
Yes.
Are you able to just share your screen with those slides a little bit? I think your data is really impressive, and the participants would love to see it.
Oh, sure. Yeah.
Thank you.
Sure, absolutely. So continuing on, and Trevor, can you see my screen well? Is everything coming through fine?
We've got a great shot of that title slide of your PowerPoint, but if you've scrolled forward, we haven't seen it, I don't think.
Oh, you're still on the title slide?
Yes, sir.
Okay, well, we're not working then. I've been going, we're on about slide 10 here.
I'm going to get Anthony to help with that
here. Yep. Should have tested that.
So just sharing your screen might be better.
Yep. Let me get.
Okay.
Okay. So.
Yeah, we can see that moving around.
So now I'm going to try and share the screen again, and that is too bad. Let's see. Now what do you see?
We've got the title slide up there if that's what you're looking at.
Did it switch?
Just waiting to make sure there's not a lag here. Michael suggests putting him into presenter view.
It's in presenter view.
Presenter view.
Yep. It's still not switching? Are you able to, is someone there, Anthony, able to upload this thing?
Yeah, I'm here, and
I'm really confused why it's not advancing.
It was there in the rehearsal, so try sharing those slides one more time. Your desktop. Try sharing your desktop instead of the slides.
Okay, do you see that?
Yeah, that looks like it worked. There you go.
Now, does this switch?
Great. Yeah, I see you moving through the slides now.
Okay. Okay, well, I apologize to everybody. Yeah. So I apologize to everybody. So we're going to rip through these things and catch up to where we were. So that was not very smooth. Trevor, let me know, are you seeing red X's and stuff? Do you see a picture of a kid with tomatoes?
Yes.
Okay. Sorry, everyone on the phone. We'll figure this stuff out after a while. So let me just go ahead. Everyone heard me chat through this. As I mentioned, I'm an accidental entrepreneur, left Emory, and co-founded Oladokdor. So you're seeing slides flip through, Trevor?
Yes, I am.
Okay, great. I talked through the outline. And then, well, you guys missed all the good slides. So this was the internet bubble bursting, and I've got a photo of an internet bubble. We reduced our employees. We were way too early to the Spanish language internet, and then I think we were about at the big pivot where we just focused on Latin Americans and their needs around culturally appropriate dietary consumption. We tried pitching that to health plans. And then I think this is about where we stopped, where we got the grant from the Robert Wood Johnson, additional funds from 3 Blue Cross Blue Shield plans, and conducted a randomized trial of about 1,000 Hispanic health plan members. You with me, Trevor? Trevor?
Yes, I'm with you.
Okay, great. Okay, everybody. Sorry about that. Okay, great. So here we are. So the point I was making, the importance of collecting data, and you know, and talking with these 100+ folks, including many successful serial entrepreneurs, they said just collect all the data you can, qualitative, quantitative, at every step of the way. Make it great, publish it if you can, but at least put it into papers, circulate it, put it out there. So we did that. We collected quite a lot of qualitative data as well as quantitative data. So for example, usability is a lot of this stuff. It's, you know, you can build whatever you want, but if people don't use it, it's not worth anything. So we asked these Hispanic health plan members, what do you like about the Medieta program? And somebody says, well, it helps me eat well using the foods from my country. We said, what don't you like about it? And I thought this was interesting. Not enough cake and ice cream. So that'd probably be true with any diet program, but it was in this case. So where's our big break come? So that was our randomized trial, our study that we got from foundational grants. The plans were not going to step up without that foundational backbone. And actually, I was sitting in my office and I got an email from the chief medical officer from Blue Cross Blue Shield of Florida who said, hey, Dirk, great work. You know, love work with you guys. An RFP just came out from the state of Florida. They're looking to contract with a company for a $2.5 million statewide program, the Hispanic Obesity Prevention and Education Program, or the HOPE program. So after many rounds, we did win that, and that was really sort of our first significant client to scale.
Dr. Schroeder, we have one
Yes.
question that came in from Arlen
Sure.
regarding that. And,
Okay.
and his comment was that, you know, WebMD is in so many languages now. And so he was wondering what it was about the timing or the intersection with that, you know, kind of RFP from Blue Cross that really made Ola Doctor as successful as it was at the time that it really took off.
Yeah, great question. You know, we were always concerned that WebMD was going to get into this, and they did. You know, they added languages like lots of companies that added languages. The reason we got it and the reason Ola Doctor continues to be successful is because that's Ola Doctor's specialty area. In other words, that's the deep expertise, is the cultural nuance, understanding, you know, the how Dominicans versus Mexican Americans think about the causes of diabetes. We did some really interesting projects with HEB supermarkets and Blue Cross of Texas, and they actually called us in and said, hey, we need your expertise to figure out why these employees are not signing up for our diabetes programs. And it had to do with things like that. So great question. It is also a question that sort of touches on competition that I don't sort of talk about much here in the talk, but you know, startups I'm working with or students, they say, "Ooh, well, we're so great because we don't have any competition." And my reaction is, "Ooh, that's a problem. That's a red flag that you don't have competition, because if you don't have competition, that means that there's not maybe enough of a market demand, there's not enough of a market need, and most importantly, there's not somebody at a hospital system or a health plan who has a budget that says my thing, your thing, that they can pay for it." So we can talk more about competition, but I think competition is great. It raises the boats for everyone. So as Trevor said in the introduction, we're very lucky, very fortunate. The company was acquired in full, an all-cash deal by Pan American Life, which is a global multinational, and we got to check the elusive exit box along the entrepreneurial journey. So that's my sort of brief overview of Ola Doctor. Not brief, it took us 20 years, 18 years. And let me now shift to sort of, I'm on a mission, and I've been on a mission for the last couple of years to learn about this process from others. And let me tell you where this started. So this started about 6 months before the acquisition was firmed up. I got a call from a first-time entrepreneur. He was a senior person at a major university that you'd recognize. And he was put in touch with me because he was building a communications platform, digital technology, to help doctors communicate with Hispanic patients. So I listened to him. I also listened to him tell me that he'd been working on it for a few years, that he was clearing out his 401k, that they were running out of money. And so I sort of stopped him and I said, wow, that sounds great, but who's going to pay for this thing? Who's going to pay for it? And he said, after a long silence, well, the health plan should pay for it. I said, oh, I thought maybe they probably should, but they're not going to. So this was one of a number of experiences that I had where entrepreneurs were essentially making the same mistakes that we made, and also then setting themselves up really for, unfortunately, lack of success. So I set off on a mission to interview experts, and really the focus was on the buyers of innovation. There's lots of stuff out there on MVPs and the minimum viable product, and lean startups, and you guys have probably read most of them as I have, and they're great, but very little on sort of how does a major health plan take a decision about buying your new innovation? How does a hospital system choose which digital technology, which readmissions minimizing technology to buy? So that's what I worked on. So I started reaching out to people, and I really just asked them 3 questions, and the interviews went from there. One was, what are some of the key challenges and common errors you see with startups that startups make in regards to commercializing their innovation? What are some of the keys to success? Sort of flip side of that, of an early stage company laying the foundation for selling into healthcare companies, organizations, and patients or consumer bases. And then finally, if you invest in or evaluate or make buying decisions about new technologies, what are the key ingredients of a successful pilot or demonstration project so that you would be most likely to purchase it if the pilot's successful? So those were my 3 sort of starting point questions, and they led to really fascinating discussions down the road. So some of you, and this analogy has been made, hopefully all of you have read Geoffrey Moore's Crossing the Chasm. This is a business guy who did some great work. I think he's out of Stanford, looking at which companies succeed, which companies don't, and why. So the chasm really is to go from sort of how do you go from these early adopters to the early majority, as this graph says. So I was focused a little earlier in the journey. I was focused on this pilot,
Mm-hmm.
sort of the first demonstration of the technology, and hopefully then the first paying client. So once I started interviewing people that I knew. Florida Blues come up a couple times. I reached out to Steve Snell, who was the VP of marketing at the time at Florida Blue. And I asked him those 3 questions, and he sort of threw me for a loop, because he said, those are good questions, but we get startups coming in all the time that really drop the ball on the basics. And he said, it's really critical to understand, these health plan executive audience that you're presenting to, and to be able to articulate the problem that you're solving. What problem is the solution solving? If the solution theoretically addresses 15 problems, you got to get them to focus on 1 or 2, and to be very clear about how the solution will bring quantifiable value to the plan. So Steve was one of my earliest interviews. This is the first time I heard this articulated in this way, and I probably heard it 20 or 30 times after that. So we'll come back to this. I focused on this sort of key juncture. But what I really came back to was that there's really sort of 4 major clusters of reasons that healthcare startups fail to get past the pilot. And getting past the pilot is really sort of code for not commercializing and not really generating revenues for success. And those 4 clusters that I've put together are what I call the fundamentals. I was calling them the basics, but they're really more important than basics. So they're the fundamentals, which pretty much any business should have. The importance of healthcare, understanding the healthcare system and operations, relationships, and then technical and tactical issues. Some detailed quotes here, just to point out a couple of them. So on the upper right-hand quadrant, healthcare and operations are things like entrepreneurs that have been successful in technology look at the spaghetti mess of healthcare and think they can do better, but they don't understand healthcare, so they fail. This healthcare and operations, I think a lot of people on the phone, this comes up a lot in these discussions. The good news about SOAP is that you guys are physicians, providers, clinicians, and others who understand the healthcare system. So I think there's an amazing role, and one of the reasons that I'm excited to be working more with the society is that there's a real role for helping other entrepreneurs navigate the system, and then for yourselves, you sort of have this box checked. In the technical and tactical, they understand how technology is going to plug into the existing EMR, He said, I need a flow diagram. Where's the data get gathered? Where does it go? How will I use it? I heard a number of stories of poor entrepreneurs who were literally at the signing table with this new innovation. The champagne was on ice, and some mid-level IT person walks in and says, "Oh, I think Epic's going to do something like that next year." Boom, everything stops. So the importance of understanding the context of the legacy technologies. And then relationships. I'm sort of going around the right-hand corner because I am going to take a few minutes to talk about these fundamentals. And this is really sort of, they're fundamental, so they're basic. You need to get them right. My kids are always like, well, why do we have to practice tennis? Well, Rafa Nadal, top in the world, trains 6 days a week and 6.5 hours a day. So getting the fundamentals right, all that other stuff really doesn't, unless you get it right, nothing else matters. So what are these fundamentals? Fundamentals, I've identified about 9. And again, if you've taken entrepreneur classes, if you've been in business, which I hadn't, then maybe these are obvious. But I'll say that I've worked with a lot of startups. I work with mid-sized companies, early stage companies, and a lot of people forget this. So I feel it's important to go back to them. So let me just take you through them quickly. So first of all, what's the problem? What's the problem you're solving? Who's suffering from the problem? And in healthcare, of course, this could be a couple of different people, patients and doctors. Who pays for it? This is a big one, trips up a lot of folks. They don't understand that, sort of who's paid for these different things isn't the same person who's using it. Obviously, what's your solution? That's sort of the easy part. And by the way, I'm gonna give you a worksheet and get a quick example here as well. What are the use cases? How's the solution going to be used in the ecosystem? Who will use it? Who will touch it? I talked with a really interesting company. They actually put almost like cultural anthropologists within the hospital system, watching nurses interact with patients, taking time, charting things, how many times they touch things, and really use that data as they increase efficiencies. What's the quantifiable value? Has it lower costs or increase revenues or whatever you're trying to do? How are you going to pay for it? I've heard, I'm a judge on these pitch competitions. People have no clue when I say, well, how are you going to pay? Who's going to pay and how are you going to charge people? You really need to think about these things before you get into the discussion of the pilot. How will you sell it? That's down the road a bit. And then, how are you going to make sure people actually use it? So these are the 9 questions. I talked with a lot of people I interviewed. They said, we've got so many issues, and of course now even more. Entrepreneurs, when they come to meet with us, they need to really be aligned with our health system's priorities. You can't just sort of read something in the newspaper and say, oh, readmissions, that must be important to everybody. We're going to go and try and pitch our readmission solution. You really need to understand what they're doing and have a deep sort of alignment. I think the other thing that's come through really clear this past year, even before the COVID pandemic, is the importance of lowering costs. So I was talking with a VP of innovation at a major health system, actually a few weeks before the whole pandemic, and he said, it's fine if their innovation's designed to do a few different things, but if it doesn't help me lower costs, I'm not interested. There's just too many options. It's too important. It's got to somehow either lower costs and certainly not cost me anything more. So priorities, what's the problem? These problems need to be big, urgent, significant. They need to move the needle. They can't be just sort of at the side. The other thing I heard more than once was that these problems and the solutions to address them need to be future problems, which is kind of mind-bending. But a number of people said, entrepreneurs keep coming to me with ways to reduce my readmissions or something I'm dealing with today. That was my problem 3 years ago when I needed to find a solution and a budget then. Send me entrepreneurs that are solving the problems I'll have 3 years from now. And I had maybe half a dozen people say, like that hockey player, I skate to where the puck is going to be, not to where it has been. So that's a challenge. I mean, that's a challenge to entrepreneurs. That's a challenge to all of us, sort of like, wow, especially with things changing, what are the problems that these healthcare administrators are going to have 3 years from now, not just today? And then the solution needs to be clear, no jargon. This is not a real example, but I've heard things like it. What's your startup do? We've created a platform that uses big data and AI to engage patients and bring value to healthcare systems and advance the triple aim. Huh? What? Next. So, I mean, you got to be clear. What's your thing do that's different than others? So I put together a small example here, and this is recorded. I'm happy to circulate the slides. And then also, and you'll see here, I've got a worksheet, that free worksheet that I'll put up on my website. I don't think we have time to go through it completely, but just to point out ZocDoc, which you may be familiar with. It's an application that somebody came up with because he was traveling and couldn't find a doctor. So he put together an app, and it allows patients to find doctors, and it allows doctors to get more patients. So going through this exercise, and I would encourage you to do this for your own innovation and technology. Just lay out in a simple, sort of one-page grid, what's the problem, who suffers from it, who pays for it, what's the solution, use cases, how do you pay? And my experience, I've done this with dozens of folks, is that it just going through and putting this down on paper, you could even have executives going, no, we do it this way. No, we're not. We're doing it that way. So it's almost a discussion piece as well. So that's this sort of core foundational, and this is will all be in the book that I'm working hard to finish, but not quite done. It'll be a couple months. Other sort of technical and tactical chapters, just to give you a flavor for the things that came out in these interviews. Should pilots be free or paid? What's the role of incubators and accelerators? Have become much more important, actually, as a triage mechanism for hospital systems. How do you pitch a C-suite? Not all C-suite folks are the same. How do you structure your pilot? Lots of people think, oh, I'm going to go after Mayo Clinic. I'm going to go after Cleveland Clinic, which takes years. They've got their own stuff. I've heard a lot of success stories from entrepreneurs who started local, got a sort of small practice, local hospital, worked with them, built up their data, had the proof, and then went to the big guys. EMRs, intellectual property, data, and some other items as well. So as I said, I'm working on a book. I'm going to package this into a free workbook that I'll post to a very newly launched website like today, and some resources. You're welcome to sign up there. There'll be plenty more in a couple of weeks. My goal really in doing this is to help accelerate innovations as much as I can. So finally, this final sort of couple slides here is how do you do all this within the context of the crisis, global crisis that we're in. You're all familiar with this. I'm here in Atlanta. A major healthcare system just furloughed 1,000 workers. At the same time, United Health and other health plans are showing, record profits. And then, of course, there's certain technologies like telehealth that are absolutely going crazy, through the roof, exploding. So very dynamic, very sort of lots of innovation, of course, around trying to do something around this pandemic. And the question is, how do you capture that? How do you make sure you get through it and then capture it? I posted I'm a big LinkedIn sort of person. In writing my book, I built a network of about 25,000 LinkedIn connections, which has been great. This was a quote I found. I do a lot of reading about the future. Stephen Glasgow, if you don't know him, is a real thought leader at Jefferson Health. This is healthcare's Amazon moment. If you're a provider and think you're going to go back to your business model solely being based on hospital revenue and not relevant to people who want care at home, I think you will be out of business. If you're an insurer and think you can just be the middleman between the hospital and the patient, you'll be irrelevant. If hospitals believe that innovation can be just this cute little thing they do in the background, but the real business is getting heads in beds, they're nuts. I think we were always wondering what the big disruption would be that got us to join the consumer revolution, and I think this is it. I posted this on Saturday. It's gotten 20,000 views and hundreds of shares and likes and all that stuff, which isn't that relevant, except that it resonated. I direct you to my LinkedIn and read some of the comments. They're very interesting. And then finally, sort of how do you get people to take decisions through all of this? So I was talking with Michael Thompson just a couple of days ago, who's the president and CEO of the National Alliance for Healthcare Purchasing Organizations. So he's got organizations of organizations, and then about 12,000 self-insured employers under that. So this is a major, about 40 million employees and members. So Michael's perspective, and he and I have known each other for quite a while, he said there's two camps. One group of companies is hunkering down. the other is doubling down. He said, we've got to be in the change business right now, and the change business is booming. He also said, and I think this is really important, is that he's seen decisions happen in 2 weeks among his constituents that normally would have taken 2 years. So decisions are happening because they have to and because they should. And then finally, Michael shared, entrepreneurs should consider piloting with self-insured employers. They are often closer to the problem, can sometimes move faster, and are willing to take bigger risks than health plans because their company depends on it. And that's been my experience as well. I think doing some of these pilots with self-insured employers is really a missed opportunity in many cases. So finally, in summary, getting past a pilot in healthcare requires, as I've said, clearly establishing the fundamentals, relationships, what I haven't talked about, but I'll be posting some articles on that, and close attention to technical issues and tactics. Of course, the COVID-19 pandemic is the Amazon consumer revolution moment, perhaps, that we've been waiting for. It's still to be determined. Certainly has unleashed tremendous innovation opportunity, and those who move quickly will win. I would say finally, you missed this slide. I think I said, entrepreneurs aren't necessarily born. What I think entrepreneurs are born with, though, is a set of characteristics, including self-motivation, the quest for knowledge, thirst for knowledge, the ability to take risks, the ability to be flexible, and certainly passion for our field. And with that, I will take questions.
Fantastic. I love that about the Amazon moment. We had a couple questions here, Dr. Schroeder in particular. Rick Botelho, I think is how you pronounce his last name, said, are you running mastermind groups in particular for innovators?
Coming attractions. Thanks, Rick. Good to have you join. Yes, that's the plan. The book is really sort of a just one of the pieces. So soon, I'm hoping within the next 4 or 6 months, I'll be launching a mastermind. So, for example, Chapter 7 is how to sell into academic medical centers. Week 7 will be, a talk, but more importantly, much more importantly, a Q&A session with the Chief Innovation Officer from Johns Hopkins and another from Stanford who I interviewed for the books and who've already agreed to be a part of that. So my goal really here is to create an ecosystem, sort of like we're doing here now, but that's ongoing and interactive. So I very much look forward to that. Thank you for the question.
Excellent. We have a CEO that's based locally here in Atlanta, Preeti Tanwar, and she helps kind of run a company that both mentors people and also does some kind of data automation and process automation. She specifically had questions about, could you share maybe a little bit more about how you leverage technology, especially analytics, when it came to automation?
For our company? Is that the question? Or I guess it's for the company that I built?
Yes, that's correct.
Yeah. Wow, that's a good question. I mean, I think I'm going to answer it a little bit differently. I mean, I think that one of the things that we see in this in the pandemic, sort of what's worked. I think of it as like sort of what has worked, what was in good shape, and what was in not such good shape. And certainly, I'd actually given a talk at Emory about a year ago, just now, on the need for better big data, better analytics, more use of artificial intelligence driven kind of approaches in public health. I mean, I'm not going to say I told you so, but this was a lot about how backwards and sort of 30 years ago public health was at the time. So we've obviously had a wake up moment. There's no doubt that analytics and big data continue to play more and more role in not only healthcare but in all industries. So I'm not sure I can give you a super specific answer except to say that it is growing. One of my favorite conferences, until we stopped having conferences, was the Connected Health Conference that Joe Kvedar leads up in Boston. My takeaway from this last fall really was, and what I was most sort of wowed about, was how much passive data collection people are starting to work with, and that is, I think we've known, is really the future. Not having to put data, on a keyboard into stuff, but having these data gathered passively and then used more in real time.
Shameless plug in that regard too. Typically every year, it's been going on for a couple of years, the Wall Street Journal puts together a health technology conference, and typically you have to be invited to be a part of that conference. But actually now, in light of kind of the recent pandemic events, they're offering it virtually, and I think it's June 2nd, all day long. And you can stream it, and I think all you got to do is sign up on the website, and they'll ask you a few verification questions, but you can be a part of it. And there's a lot of incredible thought leaders, certainly in the field, from all throughout, industry, as well as tech and entrepreneur and physicians and other stakeholders that are represented there, if you want to learn more about it. Steve Charlap is asking if this is recorded. Yes, it is, and we will make it available to you on the SOAP Facebook channel as well as on the YouTube channel. Let's see. There is a question from Asai Kanapur. It looks like he's asking, are grants the only way to go about helping get your pilot off the ground? And if you had not gotten a grant, what would have been your next way to achieve the necessary funding in the early stages?
Great question. Yeah, excellent question. I would say grants are definitely not the only way to go. Grants are attractive. I think lots of entrepreneurs don't think about them, or they go after NIH grants, so they're going after R29s. If you're familiar with those, I think, or no, SBIR grants, or not R29s, SBIR grants, and they're hard to get. So I, was coming out of academia. I had some experience with grants, so I would generally not recommend that entrepreneurs fund their initial phase with grants. If you can, you should. You don't have to give the money back. You're not selling any equity, so there's lots of dilution. So there's benefits in that area. I think the best is to find an organization, your pilot partner, essentially. I did post to LinkedIn a few days ago. I've got a sort of split decision on whether pilots should be free or paid, and after that, and then talking to a few more people, I've landed on the side of really you should hold out and work until at least you can get your costs covered plus a little bit. That gets people in the game. Certainly healthcare systems are going through a very difficult time, so you need to really demonstrate your value. But that way you're already sort of gone through procurement, you're in the budget, you've got, there's a number of benefits to actually having a monetary exchange from the beginning. So I would say through partners, grants are some, and then of course there's angel investors and sort of investor money as well. I don't think we needed that much money, actually, so it was great, but it made it a big project. We probably could have done it on half. I think people make the pilots bigger than they need to be. Get started with something small, build on it, do something else, build on it, like that.
Great. Thank you so much, Dr. Schroeder, officially,
Sure.
for the presentation that you gave. We have some questions also about, is any of your slide deck, is that material that's proprietary? Can any of that kind of be sent out to the participants on the call today?
Yeah, I will make the slide deck available. What I've got a sort of all rights reserved thing on the deck, so I guess I would just ask that it's acknowledged, that it's cited, and then my goal is to get the information out there.
Great, thank you so much. I think at this point, we are going to shift back into more of a conversational format on a
Sure.
Zoom panel.
Yep.
And so we'll make sure that this Zoom link, there it is. It's popping up right at the bottom of the screen. So for everybody that wants to continue with more of a conversational style, you're welcome to go ahead and paste this link into your browser and then use the password. This is, in fact, a different link than the invitation link that was sent out. So please, be aware of that. And also, of course, as Dr. Schroeder's, book comes out, be sure to make sure that you pick up a copy. And I'm sure that he will be grateful to have you support him and all the efforts that's brought innovation to, unfortunately, an industry in which is ripe for disruption at this point. So
Thanks.
So go ahead and there'll be a post over here in the comment section as well as the one that was on the scroll bar.
Do you need me to do anything, Trevor, or just hold tight?
I think if you are interested in just participating, I know people
yeah.
would appreciate
Sure.
it, but if you have
yeah,
a
happy to.
little time blocked off for 15 minutes, we'd
Yeah,
love to
happy
have
to.
you in the breakout.
Sure.
Thanks.
Yep.